you can see the thumb in an extended position. So extension of the thumb is kept away from the other four fingers in the same plane. As you can see this in the picture. So this is called the extension of thumb. If you keep your thumb like this, you can make out this prominences here. You can make out two prominences. One towards the ulnar aspect and the other one towards the radial aspect, and you can make out a snuff box, the anatomical snuff box in the center. So this is what you see. Now what you have to understand is we have to identify what tendon is this. What tendon is this and what is this tendon. So this tendon that is towards the ulnar aspect that goes all the way long up to the tip of the distal phalanx of the thumb is the extensor pollicis longus, just because it is long and goes to the tip of the tongue. Meanwhile, the smaller tendon, that is the extensor pollicis brevis, which will not go to the distal phalanx, but it will end in the proximal phalanx. So now let us look at the similar schematic picture. Yeah, you can see it here. Now this is the extensor pollicis longus, which goes all the way up to the distal phalanx of the thumb, and extensor pollicis brevis, which go and end in the proximal phalanx. Now if you look along with extensor pollicis brevis, you can make out one more tendon which doesn't go up to the phalanx, which ends in the metacarpal. This tendon is the abductor pollicis longus, which you can hardly make out in an extended thumb because it is an abductor. It goes more ventrally or more anteriorly. So abductor pollicis tendon, longest tendon, can be of course palpated, but the prominence of the anatomical snuff box is formed by the extensor pollicis longus towards the ulnar aspect and extensor pollicis brevis towards the radial aspect. Also, you can make out the scaphoid bone here and the floor of the anatomical snuff box. The scaphoid bone can also be seen. Thank you.